That's just really pathetic. But okay.
Well, okay. Why? Because somebody could look us up very quickly.
Well, that now that you gave them another option.
Okay.
Yeah. We actually have a call. Let's go ahead and take it. No? Oh, I guess not.
He was too scared. They were too
Right?
scared to see who was.
They probably looked it up and realized that.
And yes.
If I were to say it's probably close, who would I be insulting most? That's what I want to know.
I'd be extremely insulted.
I think that gives the callers a hint right there.
And we're in the studio with Dr. Reef Karim, and he runs an outpatient program at Beverly Hills called Control.
The Control Center.
The Control Center. And the Control Center and the Klean Center.
I know.
It's perfect synergy.
Yeah, and they're close to each other.
Close to each other.
Yeah.
It's great. Yeah, so one of the things that we really like to do on the show is talk about not just medicine and
yeah, right.
not just medicine.
The world in relation to judo.
Not just medicine and addiction, but also, what happens once people get sober in recovery, and what's positive about being in recovery, and what do people do? Why should they get sober? What's the sober experience like? Once you become sober, what does someone consider a successful outcome? And are you doing a lot of long-term following of your clients? Have you been looking at how that works with them?
We're starting to do evidence-based research on it, but we haven't up until now. It took a year or so just to get the infrastructure together to start doing that.
Sure.
But yeah, when we call the patients and check up on them and see how they're doing. But as far as something like publishable, we don't have anything like that at this point, data-wise. But yeah, I mean, the data that's out there is pretty simple. The more you stay in the program, you focus on your aftercare, and you find substitutive and alternative things to light up your dopamine circuitry, the better chance you got. If you get off and you have fun doing other things besides doing drugs or drinking, and you stay in the program, you got a higher shot and a better shot at staying sober and being happy.
So what do you think, one of the debates we have constantly is, genetic versus environmental issues. What is addiction in your opinion?
In my opinion, it's a genetic predisposition that's influenced, and those genes are turned on and off by the environment. So you could have a genetic predisposition to being a heroin addict, and if you don't have that exposure in your environment, you might not become a heroin addict. And that exposure could be trauma, or that exposure could be popping opiates because you had a skiing accident.
Right.
So yeah, you can have a genetic predisposition, but just because you do doesn't mean it's always going to be activated. It has to be influenced by your environment.
So that's epigenetic, right?
Yeah, and then on the flip side, it could be that you're not that genetically pre-wired, but you've had so much in the way of significant trauma that you've developed some type of mental health condition where you've relied on the pills. That's the self-medicating concept.
Right. And I talk about that a lot, that there seems to be, in my experience, very different types of addiction, and people like to lump it all into one, the alcoholic personality.
This is the question I was going to ask, is that you constantly hear in certain places a drug is a drug is a drug is a drug. There is a difference between a heroin addict, to me, and an alcoholic. Mm-hmm. I mean, and I know that's sometimes taboo to say, but there is some sort of difference.
So, to go back to the environmental versus genetic, the thing that I found most interesting about addiction from a neurobiology standpoint is that you've got all these different classes of drugs. You've got cocaine and meth and the stimulant Adderall in the stimulant category. You've got opiates and heroin. You've got GHB, you've got E, you've got alcohol, you've got all these completely different types of drugs that all activate and light up this same specific ventral tegmentum nucleus accumbens.
Right,
look at the way you're looking at me when I say it. It's like I'm turning you on.
I'm really trying to focus, though.
I can see it. And you have this reward circuitry in your brain that gets lit up by these certain drugs. Aspirin does not light that up.
Right.
Ibuprofen does not light it. Other drugs do not light it up. But these specific drugs that are all completely different share one same thing.
And there are some processes that do as well.
So that's where I was going,
right?
Is that you've got all these specific drugs that create an experience in this specific reward circuit part of the brain. Now, what we found is gambling, truly gambling,
or
and
gaming, as they like to call it.
Well, gaming's video games.
Right.
So yeah, so you've got pathological gambling and you've got binge eating. Those are the two that we definitely have good fMRI data looking at what it lights up in the brain, and it lights up the same areas of the brain
Right.
as the chemical addictions do. So basically, you've got all these crazy different things that light up the same area of the brain. So from a neurobiological perspective, a reward is a reward is a reward, and experience is an experience is an experience. But how that plays out environmentally is completely different.
Right.
I mean, if you take an alcoholic and you go to NA and you go to AA,
Very different.
totally different worlds.
Very different.
I mean, that in itself should tell you.
Yeah.
You know?
Well, I've always said NA was really, and this is just an opinion, obviously, is more geared towards the heroin addict. If you take a heroin addict in 20 years that's sober and you put him in a room full of heroin, it's still very tempting. If you put me in a brewery, it really has no effect.
So we're here on KLEAN Radio. You can call us at 877-830-830. We actually have a caller that we'll be taking when we come back. Call us here at KLEAN Radio, and when we come back, we'll be speaking with Bob.
Now you got me all paranoid, by the way, about the way I dance when the show comes back.
You should be paranoid.
I'm like,
don't be paranoid. Just be thoroughly ashamed.
You didn't do the overbite on that one. That was good.
yeah,
Right?
it's like, I'm like one of those guys like that would get really intense if I was like playing a guitar.
Welcome back to KLEAN Radio. Let's just jump right in this call. We got Bob from Corona.
Yeah, how you doing, guys?
Good. How are you
Hey.
All right, I found you by accident. Have the Angel Station preset, and I was just going to check out the sports, and you guys were there. It's been fascinating.
Oh, well,
Thank
glad.
you. Well, if it helps, the Lakers lost.
Don't matter. I'm an Angels fan.
The Angels
Don't
won.
care about basketball.
The Angels won.
Yeah,
That's right, they did.
I never really understood basketball. It seems like whoever throws the ball up last and it goes in wins. Somebody needs to explain to me why that's a sport.
Oh, come on.
I know.
Really?
Okay, let's get back to
I grew
Bob.
up in the Northeast. It's hockey. So.
Damn.
I know it's you can't. Once somebody has that sort of like really like thoughtful approach to why they don't enjoy something, you're never going to convince them.
So how you doing, Bob? What's going on?
Hey, yeah, I'm doing fine. Two things. One is I was fascinated by the real short discussion you had about how meditation changes the brain. So if you can talk some more about that, that would be great. The other thing is I'm a criminal defense lawyer, and I find far too often that our criminal justice system, our jails and prisons, have become a substitute for treating mental health issues and drug addiction. And it just really is a sad commentary on us as a society.
Yeah, I think I think you're absolutely right, and it's strange because it used to be that the institution wasn't a jail, but it was a sanitarium, and that a lot of addiction was seen as suicidal behavior. So a lot of people that had addictions were actually just locked up in sanitariums. Now we've criminalized the use of illegal substances, and of course we've criminalized behavior that occurs when using alcohol.
Yep.
So, which rightfully so, probably a lot of it. But instead of treatment, we have largely most diversion programs, as they were called, have largely been eradicated, and people have largely just been locked up. There has been a movement recently to try and reintegrate diversion programs back into our treatment community, I suppose I should say. But it's still difficult. Actually, we're doing a test with a diversion program with some doctors out of state, and it's actually going really well. What's your thoughts on diversion versus criminalization, Reef?
Well, it's a complicated thing, and the whole Ronald Reagan. I like Reagan, but the whole concept of changing up what happens to people, and it's not even just addiction; it's mental health as well. We used to have long-term care for mental health patients, and now we don't. Now it's kind of like, in a hospital, an inpatient person comes in, whether they're on drugs or they have bipolar disorder, they're in for like now it's like 48 hours and they're out, and they were like actively manic, naked on Wilshire Boulevard, screaming, "I love the Angels." It's like now, and they don't know what Angels they're talking about, and now it's like 48 hours and they're out. So it's a completely different shift to more outpatient treatment from inpatient hospitalization. And just to talk about the meditation part of it, it's a fascinating subject because we're seeing true activation of legitimate functional and structural brain changes when somebody meditates.
Are you doing TM?
Well, whether you're doing
Okay. TM.
transcendental.
Transcendental. I didn't know.
Yeah. Well, it was big
look
with,
like a meditator.
It was big with the Beach Boys and the Beatles. was
Okay.
the first sort of
Again, I'm 34.
it's
so.
Indian.
But I got to tell you, when your claim to fame is you were big with the Beach Boys, I don't know.
Because Charles Manson was big with the Beach Boys.
Yeah, I know. It doesn't necessarily mean anything. But what happens is you have an increase in frontal lobe activation. So your ability to sustain attention, your ability to remember things, your ability to process information, your processing speed all goes up when you meditate. That's the first thing. And the coolest thing is you have a decrease in activation in your superior parietal lobe. So that's the area of your brain that kind of determines self from non-self. So that person that gets really narcissistic and has a huge ego and is like, I'm it and this is my thing, and can't empathize with other people, can't have or feel compassion for other people, that area gets shut down so they actually can relate or connect more with other people. Those defenses drop. So in a way, you're actually increasing your ability to possibly have compassion by meditating.
And the frontal lobe issues, we see a lot of that with adolescent development and with drug addicts, right? And
yeah, you'll have frontal lobe impairment with
Right.
with problems, either mental health or addiction.
so meditation actually gives you a chance to somehow restructure some of the frontal lobe activity.
yeah, if you've had damage. I mean,
Right.
it depends on depends on the extent of
On
the
the extent,
damage.
correct.
Yeah.
And I've also found that's one of the hardest things people have. If you walk into most 12-step meetings, you say, how many of you have actually meditated? Most of them would probably, if they were honest, say, nah.
Well, think about it. Meditation's an amazing tool. It's a great thing. But if you have an impulsivity problem, you're not going to meditate. I mean,
Right.
you really have to
You're
be
structured
trained.
from the beginning.
Yeah,
not to do
it's
it.
not. It's like, okay, I just tried it. Okay, I got to go. It was like a 2-second meditation. That's not going to work.
Yeah.
Bob, did that help out at all?
Yeah, thank you. It was fun.
What kind of legal work do you do, Bob?
Criminal.
I'm criminal defense attorney.
So I guess you see a fair amount of the effect of the war on drugs with the clientele?
Just horrible. I know that, for example, the diversion programs have become harder to get through because they're cutting back on the availability because of fund cutting.
Correct.
So a program that used to take 90 days now takes 180 days, and a lot of clients can't afford it, so they get put way back on the waiting list. It started out much better than it is now, I think.
Yeah, it's a shame. We've been working with diversion for a long time, and we've been trying to create different ways of making diversion programs possible for different people at different economic levels. But it's certainly one of those areas where wealthy people have an advantage over those that have less means. Well, anyway.
Thank you for the call, Bob.
Yep, thank you for the call, Bob, and thank you for listening.
And thanks for accidentally finding us.
Right? I
All
love
right,
that.
my
Oh, he's still
pleasure.
there.
Thank you for making my trip fun.
Oh, you got it.
Great.
And
Yeah.
please call again, and we'll
Call
talk to you soon.
Call next week. We're on every Sunday, and we'd love to hear some stories.
And now he's really gone.
Now it's really gone.
Bob's a fan.
Yeah,
Bob is a fan.
one of my favorite movies about therapy.
What about Bob?
What about Bob?
You gotta like that one.
You guys, did they show that in med school?
No, they should though. They really should.
So we have our second guest for the evening who has joined us today.
Hi there.
Steve Mittleman.
You could put on their headphones if you'd like
if
to.
it's easier with the headphones.
Yeah, hi.
Who's brought in actually a lot of literature with him, and he came in prepared.
It came in prepared. How's it going, Steve?
This is my first love. I got lost in the way here. I want to thank Linda, my girlfriend, who I forgot. I wrote down.
Is that what you call your GPS?
Yeah. Garmy.
Right?
My friend Garmy.
I think she's cheating on you.
Yeah, I know. My Garmy with the British accent. And she got me here. I didn't write down the 91. I got 605, and I'm looking for the 5.
Right.
So the 91, and I shot down. I hit the 22, then back up the 405. It was.
And
just-
to the people listening out of state, these
Yeah,
are
they're
highways.
loving
These
us.
are highways in California.
My friend said the 405.
They're not grams.
I know.
Right, it sounds like a race. It's, I got the 405, the 605.
I was on the 8 ball, and then
Yeah.
I moved over to the
Yeah.
dime bag, and yeah, it was great.
So I see you have a book you brought with you called the 80-10-10 Diet.
Yeah, well, this is. I mean, what brings me here is I was in the 12-step program Overdose Anonymous for 14 years, and I left it about 10 years ago or more, and I want to talk about that. And this is just something I follow, and I wanted to mention it.
That's pretty, yeah.
Yeah.